As forensic toxicologists, you must be well versed with the condition of snakebite. How do you deal with such cases? How do you identify these cases of bite incidents that take place? Now, animal bites, when we discuss or when we classify these incidents, we may come across these snake bites. On the other hand, we have the scorpion bites, as well as a lot of spiders, a lot of species relating to these spiders, specifically. The black widow is very notorious for the poisonous venom that it disposes of to the victim's body. And you must be well versed with this condition. How do you identify and classify these conditions? Either they are homicidal, it can be very rarely suicidal, and most oftenly, they are the accidental cases that we usually come across. As toxicologists, it is the duty of the medical officer to identify the type of poison, again, the mode of action of the poisons that take place on the entire body, as well as the fatal dose, the fatal period of any poison. The fate of the poison is again very important. How does it excrete out of the body? What are the metabolic conditions that it faces inside the body is again very important. So this is how you basically monitor and manifest whenever you have these cases of toxicology and poisoning at your hand, and specifically when you're dealing with the animal poisons. So it's again very important that whenever it is basically sometimes a fatal kind of a condition that you're facing. So you would be having the post-mortem examination of these dead bodies, and you must know what to look for when you have these cases of snake bites. So usually you would find the exact location of the bite, and that also is going to mark the two fangs. So there are going to be the two bite marks that are present. The fangs are going to be seen. The fang sites are going to be seen. Again, you're going to look for the local factors. For instance, there are the necrosis, and all of these necrotizing factors are found locally at the site of bite. So they're again very important, and that make you suspicious that it's some kind of a snake bite incident that took place in this individual, and that really caused the death of the individual. You would look for the different hemorrhagic sites, whether it is the hemorrhage which is taking place internally, or either it is the external hemorrhages, which are quite profoundly found on the orifices of the body. It can be the oral cavity, it can be the anal orifices, which can be quite frankly seen that the hemorrhage has took place in this kind of an individual. Again, we have the other mechanism of infections. For instance, we have the neurotoxic snake venoms, and they're going to exhibit their own signs and symptoms. So this is basically the major duty as a medical officer. When you receive these patients, you should know that what are you going to focus on. If the patient is alive, obviously, you would be focusing on the emergency treatment. The guidelines are almost there. We should know what are the do's and the don'ts of the snake bite management. Sometimes it's more important to focus on the don'ts of the management, because we sometimes as an individual perform some of the activities, and even we should be well versed to educate the patients around us and educate the individuals around us when they're trying out the home remedies. They should be avoiding those don'ts at home. So this is again very important to educate the individuals and to educate the public regarding the don'ts of the snake bite management over here, and we'll be discussing all of that over here in this particular lecture. So usually when these patients come up to you and you have these individuals, a lot of home remedies have been tried. For instance, there are these mechanisms that are tried out by applying a tourniquet just above the bite that has taken place. So this was a myth that was basically tried upon, and a lot of years it was basically practiced that a tourniquet was placed just proximal to the site of the bite, and it was thought that basically it is going to stop the circulation of the venom externally, and is basically making the venom localized to that bite site. But it was a misconception, and you have to basically educate the patients towards and educate the public towards the fact that the tourniquet application is now obsolete, and we do not really practice this because that is basically going to cause gangrene of that particular site. So this is now obsolete, and it is a malpractice. If someone is trying this tourniquet application, it is basically a malpractice. Again, we have a lot of other don'ts that we have to consider. For instance, the application of incisions proximal to the bite site, it is now obsolete and we do not try it at all. And again, washing or rinsing the bite site is also not quite focused on, because sometimes if the venom is present locally at the bite site, it is sometimes used for the identification of the snake that was present. What kind of the snake bit the individual is very important, because sometimes it helps you choose the anti-venom that you're going to administer in that particular patient. So it's again very important that you focus on these facts. Do not rinse, do not wash the bite site. What you have to do is basically immobilize the patient unless the patient is traveled to a nearby hospital and the medical support is available. What you can do at home is immobilize the patient. This is the first thing that you're going to tell the normal public, that in case of any snake bite incident, the immobilization of the patient is very important. Reassure the patient. Reassurance is very important, because not all snakes are poisonous. Almost 50% of the snakes are non-poisonous. So sometimes due to the allay of the fever and due to all of these phenomena, the person goes into a neurogenic shock. It is not the snake bite that is causing death in a lot of individuals. It is the shock that is causing the fear, that is causing the neurogenic shock to take place in the individual. So the reassurance is very important that even the snake can be a non-poisonous variety or a non-poisonous species. So you just don't have to panic, and just make the patient lie down on his left lateral position rather than lying on the back. Why is that recommended? Again, when you ask the patient to lie on the back, it can cause the respiratory distress to the individual. So this is sometimes prohibited, and you ask the patient not to lie down on his or her back. You only ask the patient to lie in a left lateral position, and that is the most ideal position. You keep the limb lowered down than the heart position, and this is again just to prevent the venom to just enter the circulation. These are some of the steps that you can take at home. If it is a spitting kind of a snake and some of the venom has entered your eyes, you can obviously try for rinsing off the venom of your eyes. So this is all that you can do at your home until you reach the emergency departments or the hospital setting for the further treatment. This is how you educate the patient regarding the do's and don'ts of the snake bite management. This is very important. Again, if the snake is caught and that can be identified, it's the most ideal situation, but you do not usually ask the patient to kill the snake or to get the snake to the hospital. It is usually a polyvalent treatment that is given to the patients. So it is the usual kind of treatment that would be given, in which even if you were not able to identify the snake as a patient, it's okay. And basically, as medical officers, you are going to administer a polyvalent antivenom to these patients, in which the snake is not identified, which is the newer variety of the antivenom that is available. Again, the treatment of the snake bite has its own contraindications. It has its own complications. So usually before you go on and start off with the full-fledged treatment, you give a test dose that is ideally given to these patients, just to see if the patient is allergic, or he or she even may go into a hypersensitivity reaction after the administration of the antivenom to these particular patients. So usually the patients have a serum sickness kind of a syndrome as seen whenever you administer this antivenom for these particular patients. The patients would complain of headache, nausea, vertigo, dizziness. All of these are features that are seen as a part and parcel of the antivenom therapy that is given to these particular patients. But in some cases, it is a severe kind of a hypersensitivity reaction that is seen, and you have to look for this kind of a hypersensitivity type 4 reaction seen in a lot of patients. You administer a test dose prior to the administration of the major dose, that is almost 60 ml of administration that is given in usual cases. After you have given the test dose to these particular patients, you would go through the administration of the general dose, that is 60 ml. You administer 1/3 of this dose locally at the site of bite. 1/3 of the dose is administered intramuscularly, and 1/3 of the dose is administered intravenously. This is how you administer the complete 60 ml. It's not administered IV wholeheartedly, nor intramuscularly, nor locally. It is the division that is very important over here, because you have to look for the signs and symptoms. Locally, it is causing the hemorrhages, necrotization phenomena, and you have to focus on that as well. Intravenously, you have to stop the coagulations, the fibrinolytic reactions that it is causing. So you're also going to administer intravenously in these patients. On the other hand, intramuscular administrations are very important for the slow release of antivenoms over a period of time. So this is how you go about, and this treatment is very important. The normal mortality rate with the snake bite poisoning is almost 40%. But when you administer these antivenoms, it reduces the mortality rate to almost 10%. And that is a significant amount. That is a very excellent prognostic factor seen with the antivenom administration. So this is the complete management, or the major guidelines for the management of the snake bite poisoning in these particular cases. Moving on, it is again very important, as I was focusing on the fact that not all these snakes are poisonous. So it's very important sometimes to identify or to distinguish the features of the poisonous snakes from the non-poisonous snakes. Over here, when we have an overview regarding the different features over here, we look for the facts that the poisonous snakes usually have body scales that cover the entire belly. So you basically look upside down and observe the belly. It is usually scaled in cases of if the snake is of a poisonous species, it is going to be scaled and is going to cover the entire belly. On the other hand, a feature of the non-poisonous snakes is that they're really small in size and moderately large, but they don't cover the entire belly. So when you observe the scales of these animals, which are non-poisonous, they're going to be not that large in size. The scales are smaller in size as compared to the poisonous variety. And again, it is not going to cover the entire belly. So this is one of the point that is distinguishing between the poisonous and the non-poisonous variety on the other hand. Next, we have the head scales that are again very important. In case of poisonous snakes, the head scales are very small, but in some varieties, we have the distinguished large scales as well. In case of non-poisonous snakes, usually the head scales are large. So this is one of the factors that if the snake scales are small, it is most likely to be a poisonous snake. But it is not a rule of thumb. It may be a poisonous as well as a non-poisonous snake as well. It's just a general rule that you have to remember. Moving on to the fangs. This is the most important point. The poisonous snakes have fangs, which are long and canalized just to transfer the antivenom, like the hypodermic needles. So these fangs are basically used for the purpose of administration of the venom, and that is why they have to be canalized as well. So they're long and canalized. Again, there are even differences amongst the poisonous snakes as well. For instance, there are differences between the Elapids and the vipers. There are again the different species of the snakes that we're going to study further on. So these fangs can even be short and fixed. They can be even long, but the presence of the fangs is usually suggesting that the variety or the species is poisonous, whatsoever the species is. In case of non-poisonous snakes, usually the fangs are sometimes even not present. The bite marks are going to suggest some peculiar features in cases of non-poisonous snakes. But even if they are present, they are usually short and solid and they're not canalized because there is no venom present in these particular cases of non-poisonous snakes. On the other hand, when we move on to the tail, it is usually a compressed tail that is seen in cases of poisonous snakes, and the tail is not markedly compressed or it is kind of tapering as seen in the non-poisonous variety of the snakes. Nocturnal. Now, they're usually found to be nocturnal. The word nocturnal basically refers to the fact that they come out at night. So they prey at night, they come out at night, and that is one of the major factors over here that is going to highlight that this variety is poisonous in its nature. Two fang marks with or without the small teeth marks. So if they just have the fang marks, that is suggesting the fact that this is a poisonous variety of snakes that we're dealing with. In non-poisonous snakes, they would come out at any time of the day, not specifically, they're not specifically nocturnal in their nature. A number of small teeth marks in a row, that is suggesting that they have other teeth on their lower jaw. That is suggesting that other than the fangs, they have the other set of teeth as well. So this is the most distinguishing factors when you'd be observing the bite marks of these snakes. That would be suggesting a lot of factors. So as a forensic toxicologist, it's very important when you're dealing with the living patients, or obviously forensically, it's more important when you're dealing with the dead bodies and you're identifying whether the cause of death was a poisonous snake or was it some other suspicious activity that took place, and you'd be investigating that basically caused the death of the individual. So focusing on the investigation over here is more important, and just inspecting the bite marks would suggest a lot of features in this particular case of snake bite poisoning. The classification of snakes is usually, it can be either a poisonous or non-poisonous variety. So this is one way how you classify snakes. On the other hand, the mode of action or the mechanism of action of venoms is again very important, and it's another way how you classify snakes. On the basis of the poisons secreted, we usually classify snakes. And on this basis, obviously, we have the Elapids, which basically encompasses the cobra, the king cobra, and then we have the krait and the corals. So these are some of the varieties that are included in this entire group of Elapids. Now, what is significant and why are we putting all of these together in a separate group is the kind of venom that they're secreting. They're usually secreting the venom which is neurotoxic in its nature. Now, whenever we use this word neurotoxic, it's again suggesting the fact that the most important enzyme that it is secreting is cholinesterase over here. It's acting on the neuromuscular junctions, and that is basically resulting in the paralysis of the muscles, the flaccidity of the muscles, the overall weakness of the muscles, and again, it would be depending upon the system that it is affecting. If it's the respiratory system, the patient may go into a respiratory distress syndrome. So this is the kind of conditions, and the clinical symptoms again would be quite different. There would be a set of symptoms that would be seen in these particular patients. Then we have the vipers. So we have a lot of varieties over here. We have the pit vipers, and then we have the pitless vipers over here. Now, the kind of venoms that they secrete are vasculotoxic in nature. Whenever we use the word vasculotoxic, it is dealing with the blood and the circulatory system. So it would be containing the fibrinolysins, the fibrinolytic activity, the hemolysins would be there. So all of these collectively are going to cause the hemorrhages. Hemorrhages again would be either the internal hemorrhages that are taking place. It can be including the spleen, the kidneys, or the visceras. A lot of other visceras can even be involved. And when you take out the samples in such a death and you send those to the histopathology reports, that would basically reveal that there are a lot of internal hemorrhages that took place. And that is going to make it more easier for you to identify that the group of the snakes that was involved in this particular case of death was vasculotoxic, which would be most likely a viper. So this is very important, how you carry out your post-mortem examinations, when you'd be carrying out the samplings and when you'd be taking out the samples and sending them to the histopathology reports. That would be clearing out the facts, the kind of snake that was the cause of death in this particular case. How do you identify these cases? Moving on, we have another variety of the snakes that we usually can come across, and it is the sea snake variety. Now, when we consider these kind of snakes, we must know that the kind of venom that they are secreting is myotoxic in their nature. The word myotoxic is basically referring to the fact that over here we are dealing with this kind of antivenom that is acting upon the muscles and the muscular activity is basically affected due to this kind of an antivenom. Now, what is basically happening over here is it can even affect the respiratory system of the individual, and that is basically going to result in the respiratory distress syndrome. Usually, these kind of sea snakes are not fatal, and usually the patient can come out and the kind of paralysis that they're causing is not fatal over here. So we basically dealt in with these three major varieties of, or the three major subclassifications of snakes. Talking about, we have the Elapids, we have the vipers, and we have the sea snakes. When we are carrying out the investigations in these individuals and sending out the histopathology reports for further analysis, we'd get to know whether it was the neurotoxicity that caused death or whether it was an internal hemorrhages, a massive bleed that basically led to a hemorrhagic shock and ultimately caused the death of the individual. And even it can be the respiratory distress and the syndrome that is basically resulting in death of the individual. So knowing and identifying the kind of species is again very important over here. Sometimes, even by looking at the snake, in a lot of cases, the patients would bring the snake, the variety of snake up to you, and you can even identify by physically looking at the snake. If it is brought to you in a killed form, when you look at it, if it is having a long cylindrical body with a rounded end, with large scales, it is usually an Elapid that you're dealing with. On the other hand, if it is a viper, it has much shorter length. It has tapering ends, and obviously it has a triangular shaped head. These are some of the features of vipers. Again, we already know that the kind of the neurotoxin that the vipers secrete is neurotoxic in its nature. is vasculotoxic in its nature, and on the other hand, the Elapids usually secrete the neurotoxic variety of the venoms. So identifying the snake is very important, whether it's a sea snake, an Elapid, or viper is very important over here. Dealing with Elapids, we have a lot of examples. For example, we have the cobra, we have the kraits. So again, it's not quite necessary to exactly identify the snake, but rather you must know the kind of the group that it belongs to. And that is how you can deal with the kind of the mechanism of action. You already know the mechanism of action of the venom, and then you can even give the symptomatic treatment to the patient accordingly, the generalized treatment, depending upon if the patient needs a ventilator for the respiratory paralysis, you would arrange for that. If the patient needs units of bloods to be transfused, you would arrange for that. So that is how you basically plan or manage in cases of live patients that you get to manage. Now, the characteristics of snake venom, the general characteristics of snake venom are, it is usually clear when you look at it, it's transparent, amber tinted fluid in some cases, and it dries into a yellow granular mass. So if usually when it is not rinsed, but in a lot of cases, the relatives or the friends or the bypasses who brought the patients to the emergency departments would tell you that it is already rinsed and washed. But in some cases, if it is not rinsed, you would find that there is a yellow granular mass that dries up proximally to the bite fangs. Then it can retain its activity for many years. It contains toxalbumins, and then we'll go through and study what are the kind of enzymes that it contains that basically gives the mechanism of action to the kind of the vasculotoxic or the neurotoxic variety of snakes that we're dealing with. So knowing this kind of the kind of toxalbumin that is contained by a particular kind of a variety is very important over here. The kind of enzymes that the snake venom contains are, we have thromboplastins. So obviously it has the fibrinolytic activity, and that is why any venom that contains thromboplastin is going to give rise to the hemorrhagic activity that is going to take place. Again, we have the agglutinins. So the coagulation can be one of the mechanism of action how the snake venoms can act. Then we have a lot of venoms that have cardiotoxins. It can even cause tachycardia. On the other hand, it can cause tachypnea, that is increase in the respiratory rate or increase in the heart rate. So the tachycardia can sometimes be, it can be a diastolic failure, or either it can be a systolic failure. Even identifying this fact is very important, because that is going to help out the kind of the treatment that you're going to give to this particular patient, the ICU management that you're going to monitor for these particular patients. So the cardiotoxicity is very important, and it is sometimes seen in a lot of venom activity. Hyaluronidase is going to act upon the hyaluronic acid, and it is going to act as a breakaway for the hyaluronic acid. Then coagulase, we can have the lecithinase activity that is going to act upon the lecithin. Moreover, we have the fibrinolysins. So we have the fibrinolytic activity that is going to stop the clotting even at the bite site. So a lot of hemorrhage or a massive hemorrhage is sometimes seen at the bite site. Sometimes the urine, it contains blood, and all of this is basically referring to the activity, the hemolytic activity of the venom that is seen over here. Then moving on, we have the proteolysins over here. So this proteolytic activity is again very important over here. And we can even focus on that. Then we'll have the neurotoxins over here. As I was already focusing on the fact that the neurotoxins, for instance, we have the cholinesterase, which is acting as a neurotoxin. It is going to act and is going to be present at the neuromuscular junction over here. So it is going to basically result in the flaccid paralysis, or the limb paralysis, and even the respiratory distress in these individuals. We have the cholinesterase as an individual enzyme. We have the hemolysins that are even present as a chemical composition of the snake venoms. Moving on, we have the neurotoxic venoms, and they act on the activated, as you can even see over here. Basically, a healthy receptor is compared over here with a receptor on which a venomous enzyme has been present. So, as you can see over here, in a normal receptor, as would be seen at the G protein, that would appear as this. And then when a venom molecule is present over there, that is going to block the activity at the neuromuscular junction. So this is how it is going to take place in cases of neurotoxic venoms. The symptoms that it is going to produce are the muscular weakness of the leg. Then it can have the paralysis of the facial muscles and the respiration even, as can be seen over here. We can have the cobra venom convulsions and even the paralysis, which is seen over here. We can have the krait venom and muscular paralysis, which is again one of the major feature over here. And then moving on, we have the local symptoms with less as compared to the viper. So the Elapid vipers will have the local symptoms much more, as you can see over here. So these are some of the symptoms that are produced with the neurotoxic venomous activity. On the other hand, we have the vasculotoxic venoms and the effects that it produces. So over here, you can observe that we have the enzymatic destruction of the cell walls, which takes place due to this vasculotoxic venom. Moving on, we have the coagulation disorders. A lot of hemolytic activities is going to result in the internal hemorrhages as well as the external hemorrhages. Moving on, we have the red cell lysis that can take place. Then we can have the destruction of the endothelium of blood vessels and even the other tissues. Then we can have the oozing of the blood and cellulitis at the site of bite. Hemorrhages from all external orifices of the body. So when you'd be observing these postmortem cases, in cases of vasculotoxic snakes, or the venom was vasculotoxic in this kind of variety of the snake, then all of these features would be present and you'd be looking for these features. Locally at the bite site, there would be a massive cellulitis seen. A gangrenous activity would be accompanied by that. And obviously, hemorrhages would also be seen at all of the external orifices over here. Moving on, if we're dealing with a kind of or with a variety of the snakes that releases a myotoxic venom, we must know that the myotoxic peptides is basically, it can have a cationic sequence, and on the other hand, it can even have the hydrophobic dissequence. So these are two mechanisms of actions that it can follow. On one hand, we have the linking of the myotoxins to the plasma membrane of the muscle cells. And on the other hand, we have the insertion of the myotoxins in the lipid bilayer of the muscle cell membrane. So these are the two mechanisms of actions. Both of them are going to end up in the destabilization of the muscle cell membrane. So over here, we just had a look at how it is basically differentiated from the neurotoxic variety of the snakes. That was acting on the neuromuscular junction. But over here, these two distinct mechanisms are ending up in the destabilization of the muscle cell membrane over here. Effectively, it is going to result in the disruption of the membrane permeability, and that is going to end up in the myonecrosis. The muscle wasting is going to be seen in these patients. On the other hand, there would be a muscle rigidity rather than flaccidity that is noted down for these individuals. As a result, we'd have a generalized muscular pain. The agonizing pain is the most important feature over here that you're going to focus. If the patient is complaining of an agonizing pain, that is most likely indicating towards the fact that the underlying mechanism has some sort of a myotoxic mechanism of action that it is taking place with. Then, obviously, the patient may have the myoglobinuria. Myoglobin is going to be present on the urine analysis. After 3 to 5 hours, respiratory paralysis takes place in fatal cases. So this is going to be the sequence of events. Usually, luckily, they are not quite of the fatal variety, but if it goes into a complicated state, it can even end up in the death of the individual. So having foreseen the sequence of events and the cascade of events is very important over here that you have to focus on. The signs and symptoms, it's basically going to be depending upon the case, as we have already gone through the multiple factors over here, that how can the snake variety depend upon the kinds of the clinical features that it is going to encompass in these individuals. For instance, if it is the flaccidity that is noted, that is more of the fact that the kind of the snake was neurotoxic in its nature. On the other hand, if it's a rigid paralysis, then it is going to be most likely sea snake, which is basically releasing a myotoxic variety of the venom over here. So the signs and symptoms are going to be dependent upon the fact that what kind of snake species we are dealing with. If it's an Elapid snake bite, the most important signs and symptoms would be giddiness and lethargy. The patient would complain of muscular weakness. Moreover, the patient would complain of spreading paralysis as well as salivation, repeated vomiting, difficulty in speaking, that is known as dysarthria, dysphagia, that is basically the difficulty in swallowing. Ptosis, drooping of the eyelids, is one of the major factors over here in cases of Elapid snake bites. So these are the features that you're going to observe, and then the patient would also complain of the paralysis of the extraocular muscles. When you ask the patient to move in the conjugate directions, the conjugate gaze would not be seen. The 6 cardinal directions are going to be noted down. Slow and labored breathing, there is going to be difficulty in breathing as well. After a few hours, the respiration basically ceases, or the patient goes into a respiratory distress syndrome in these cases. On the other hand, the patient can have convulsions, there is going to be a cardiac arrest, and death may ensue in these cases of Elapid snake bites on this particular note. Then we have these viper snake bites on one hand. In this particular case, we have the severe local pain that is observed in these particular cases. Swelling and oozing of the hemolytic blood is seen. As we all know that the viper snake bites is going to administer a vasculotoxic venom that is going to result in these kind of symptoms. Nausea and vomiting is one of the major features over here. And then we can have the hemoglobin uric nephritis due to the intravascular hemolysis as seen in these patients. Observing the eyes of these patients would reveal that the patient is having petechial hemorrhages, which is one of the features of asphyxia. Even when you'd be seeing these individuals on the postmortem table, you would look for these petechial features, you would look for these hemorrhagic features, and that is going to highlight the fact that the snake was of the viper variety in this particular case. Moving on, we have the sea snake bites over here. Now, usually the kind of myotoxin that they secrete is going to act upon the muscles. So the symptoms would consist of a generalized but agonizing muscular pain. Stiffness, rigidity is a very important feature of sea snake biting over here. Then the patient can have myoglobinuria as well. This is one of the feature. And when we are going to look for the lab investigations, the serum transaminase levels are going to be elevated. The patient is going to have hyperkalemia in these particular cases. Respiratory failure finally ensue in these cases. Cardiac arrest is going to take place. The fatal dose for the snake venom is 15 milligrams of dried cobra venom. It's different basically for different species. 20 milligrams of viper venom, 6 milligrams of krait venom, and 8 milligrams of saw-scaled viper venom. This is the fatal dose that is observed for these particular cases. As you can even observe over here, that the smallest variety, that the smallest dose that is effective or that is causing the death of the individual is of the krait venom. So it is the most poisonous variety of the snakes, as you can even observe and compare over here. Now, the fatal period is even different for different varieties of the snakes. Death from cobra usually ensues within few minutes to few hours. Then we have from viper, it can even take place in a few days. And sea snakes, they usually bite and they are mostly non-fatal in a lot of cases. So it's the reassurance that you usually give to the patients. The management of the snake bite, as we've already gone through the do's and don'ts of the snake bite management, we must know that the rinsing, the washing, the tourniquet application, the suction, all of these are the misconceptions that were done in the past and now they're obsolete. The allaying anxiety and fright is the first and the foremost step that you would take in these patients. Moving on, we have the prevention of spread of venom that is done by different methods. For instance, you demobilize the affected limb, you ask the patient to lie down, do not panic. These are the steps that you're going to take place. Again, the anti-venom is administered, and this is the most important, the life-saving step of the snake bite management over here. Now, there are two kinds of anti-venoms that are available. One is the specific anti-venom, which is usually administered in cases in which you know what kind of snake was present or what kind of snake that you're dealing with. On the other hand, we have the polyvalent variety. The difference between these two is basically the specific anti-venom variety is basically produced when you inject a horse with that specific venom. For instance, it can be a cobra venom or it can be a krait venom that is known as a specific anti-venom. But polyvalent anti-venom is basically produced when you inject a horse with 4 different kinds of venoms, and that basically produces a polyvalent anti-venom over here. Usually 4 kinds of venoms are used in such a case. We have cobra, krait, russell, and sea snakes that are usually used in this particular variety of the polyvalent administration. So this is the kind of anti-venom that we usually administer in these particular patients. The prevention of the spread of venom is one of the important factor over here. The anti-venom that you're administering is very important. Administering the specific anti-venom and the polyvalent anti-venom has its own complications that we're going to consider over here. The fact that has to be kept in mind is basically a lot of complications can take place with the administration of this anti-venomous administration. So you usually give a test dose to the patient and ask the patient or even monitor the patient if he or she is having the hypersensitivity reaction or not. And that is basically going to elicit the fact or the specificity of this particular anti-venom administration. Post-mortem appearances, we must focus on the fact that the bite site is located. You look for the local factors that are taking place. For example, any kind of agglutination, hemorrhagic activity, necrotizing fasciitis that can take place locally at the sites is very important. Then even petechial hemorrhages, as seen even in this case, you can observe that it is basically indicating a sort of an asphyxial death. These are the features of asphyxial death over here. And even that can be seen over here in cases of neurotoxic venoms if they are administered in these particular cases. Medico-legal aspects, we have to consider that usually it is a case most likely of accidental cause, but still we have to complete the investigation and look for any other certain cause of death if it is present locally. It is rarely homicidal and very rarely suicidal as it took place as we relate to the stories of Cleopatra. So these are some of the medico-legal aspects that we can look for by running through the history or even closely examining the cases. That is going to highlight the fact what was the aspect of death in this particular case. It can be even a case of cattle poisoning. So usually a lot of cattle poisonings are done by the snake bites, and you have to look for these factors as well. So in this particular lecture, we focused on the snake bite management. How do you identify that this particular death is caused by the snake bite? and how do you really manage these cases? What are the post-mortem appearances in cases of the snakebite incident over here? So that is the end to this lecture. Thank you for watching sqadia.com.